Hey guys. Okay. Hey guys. We are doing another live at 5 here at Valencia Medical Center. This is Dr. Abraham, and today we're going to be talking about dermal fillers, and we're going to be answering your questions as well. So if you guys have any questions about that topic, please let us know. So fillers are obviously a very commonly done procedure. We do use a lot of fillers here. The two kind of most common brands that people are aware of are Restylane and Juvederm. And within these two brands, there's multiple dermal fillers that can be used. And there's also Radiesse, there's Versa and RHA. So there's a couple different ones. There's Politero, but by far we mostly use here Juvederm, which includes Voluma, Volor, Volbala, Juvederm Ultra, Juvederm Ultra Plus, and the Restylane family of fillers, which includes Restylane Lift, Restylane Define, Refine, Restylane Kiss, Restylane Classic. And so if you guys have any specific questions about any of that stuff, let us know. But mainly we're talking here about facial rejuvenation, and so these are the fillers that we often use in the face, and the exact filler we use is going to depend on the person's anatomy, and it's going to depend on which area we're treating. For example, if we're trying to lift the cheeks, for example, we would want to use something different than if we're trying to fill in the lips or the under eyes, for example. So I know you guys have sent us a couple of questions too over over the last week, so we're just gonna go through some of these and kind of answer them as we get going from some of the questions that you guys have DM'd us.
Here is, I know it's probably a common question, but it's, what is the difference between Botox and filler?
Okay, yeah, so Botox is a neuromodulator. It's like a muscle relaxer. So usually we use Botox commonly in the forehead or around the 11 lines, because these lines you see when you move your muscles. For example, when you lift your forehead, you lift your eyebrows, you move your forehead muscles, and you get these deep lines in the skin. And when we relax that muscle, we use something like Botox, and that helps smoothen that area so that you don't have as much movement. If you're doing the lips, for example, or if you're doing the smile lines even, you're not trying to have less movement. You're just trying to add volume where you've lost volume, and that's where fillers come in. So fillers are going to add volume. Common places to do fillers are going to be in the cheeks, in the smile lines, in the lips, in the chin. Again, we're not trying to decrease the movement there. We're just trying to add volume. In the forehead, though, we are trying to decrease the movement a little bit so that we don't kind of, when you raise your eyebrows, you don't get these deep lines, or when you do kind of that angry face, you don't get the 11 lines. So when we're trying to do that, that's when you use Botox. That's kind of the main difference. Now, within fillers, as we were talking, because I know one of the other questions further down was about like the different types of filler. So fillers are mostly going to be made of hyaluronic acid, but they're going to be structured differently, and so some of them are going to be more firm, some of them are going to be a little bit more soft. So there are going to be different fillers that are going to be used that are going to be more ideal for different areas. For example, when we do cheeks, commonly we use something like Juvederm Voluma or Restylane Lift, sometimes even Radiesse, and these tend to be a little bit thicker. They tend to do a little bit more lifting, and a lot of times they actually tend to last a little bit longer because they hold better together. But then when we're doing lips, for example, or if you're doing the under eyes, these fillers might not be the ideal choices over there. So we might want to move to something like Juvederm Volbala or Juvederm Ultra, for example, for the lips, or Restylane Kiss, which is a great filler that's made specifically for the lips. So that's why there's a wide variety of fillers, because each one's going to have slightly different properties, and it's going to be slightly better for different areas. Let's take another question. We're going to go with, somebody was asking, I think, about the topical hyaluronic acid serum as opposed to hyaluronic acid filler. They're definitely not the same. you're not gonna get volume from applying topical hyaluronic acid. They're both great for what they do, but they do completely different things. So topical hyaluronic acid is you can think of as a moisturizer. It's gonna keep your skin hydrated. It's good. It's a good product, but it's not gonna add any volume. It's not gonna. Its effects are you're only talking about when you apply it for a few hours. After that, that's how long it lasts. And it's not adding any volume. It's not doing any lifting. It's just moisturizing the skin. When you're talking about dermal filler, we're talking about different product over there. We're talking about adding volume. We're talking about something that might last a year, up to 2 years, or maybe even more, depending on exactly which filler is used. So even though they're both called hyaluronic acid, they are both completely different products.
Somebody's asking, can Botox be used to lessen the tug of other muscles downwards? Example, DAO. So maybe using Botox in the two areas under the corners of the lips and then filling the lips to return volume.
Sure, absolutely. So that is a common muscle we do here, and I think they're talking about a lot of times we get that downward smile where the edges of the lips look like they're turned a little bit downward because the muscles here are pulling a little bit too strongly. So with that tug of the muscle, if you relax the muscle, you don't get that pull that's pulling the lips down as much. And sometimes we do use Botox here to help correct that downward pull. Now, a lot of times there's also a loss of volume over here in that area, the marionette area, which is right around the corners of the lips. So we can add fillers to correct that. So a lot of times you're using Botox in that area, many times you're using fillers, and many times you're using a combination of both. Whether it's to correct the area or whether to improve the lips in general, if someone comes in and they want to improve the lips, we might want to do fillers in the lips to add volume, but then do something like you're talking about here to help improve or decrease or even reverse that downward pull that the muscles can have. That's a great area for Botox to use. There are other areas where we often use Botox. We use it often in the masseter muscles for people with TMJ pain or people who grind their teeth. A lot of times that is associated with a strong masseter muscle, and the masseter is that muscle that we kind of have around the angle of the jaw, and it plays a role in chewing and stuff. So we when we put a little Botox there, you still can chew just fine, and you still can eat and do everything just fine. But what's gonna happen is it's not gonna be so strong to the point where when you're relaxed at night, you're kind of unconsciously grinding your teeth, for example, or you're putting too much pressure, so it relaxes that muscle that way. So that's a common, more medical than cosmetic use of Botox. Also, although there are actually some cosmetic benefits due to doing Botox in the masseter muscle because it can soften that area. So a lot of times we get females in particular who have a very, who don't like when their masseter is really heavy because it can make the shape a little bit more square, and it can make that area pop up a little bit more. And so by kind of adding Botox there, you kind of get what we sometimes refer to more of that heart shape when that area of the jawline gets a little bit softer. So that could be a cosmetic benefits of Botox in the masseter, as well as relaxing the muscle and kind of lessening that teeth grinding, that TMJ pain, and sometimes headaches that can result from too tight or too strong of a masseter muscle.
Can you use filler for your chin, like to a definition for chin?
Of course, yes, and actually it's kind of fillers in the chin have been used for a long time, but there's a couple fillers now that have recently got the FDA kind of approval or clearance for use in that area too. So it is a commonly done area. There's a couple fillers that can be used there. Within the rest of the family, usually we use a combination of define and lift, which again are a little bit stronger. So because with the chin, again, you want something that you're gonna put that's gonna stay there, that's gonna be a little bit more firm. Or we use something like Juvederm Voluma, which we often use in the cheek, also plays a great role in the chin. Sometimes I also like to do some voluma. So right in the middle of the chin, we might use voluma, but sometimes we also like to use either Ultra Plus, which is also very dense, or even Velour, which is a bit softer than voluma, but it's great to help around kind of the area connecting the marionette, or the marionette lines are to the chin, so kind of defining that area and defining that part of the jawline. So depending again on the client, but there's definitely a few fillers that can be used there, and we do use there a lot. And a lot of people do really see a good difference with the chin, whether it's they're trying to bring the chin more forward. Could be that they're trying to get the chin more round, kind of in the middle, or sometimes in the middle they're trying to make the chin look wider. And all of these are things that can be improved with dermal filler in general.
Is there a permanent filler that would fix a dimpled chin?
There are some permanent fillers that can be used, like Bellafill. We don't usually do a lot of these fillers here. Sometimes there are a good option for the right person. I wouldn't usually recommend starting out with the permanent filler because there are a few kind of complications and drawbacks to permanent filler. The positive aspect about them obviously is that they are permanent, but I would at least start with the Juvederm, something like Voluma, which can last 2 years, sometimes more in certain areas where there isn't a lot of movement. But if you do a Voluma and it doesn't give you kind of the look that you're trying to get, you can reverse it, for example. Or if there's any kind of complications, it's a lot easier to reverse something like the Voluma which is a lot harder with the more permanent fillers. So there are permanent filler options, but you do want to kind of be educated about them and make sure that you are the right candidate for it and they are the right option for you, as opposed to just kind of doing something that might be associated with a few more risks, or that you don't like the results of, and then you can't fix easily.
So you were talking about like how long they last. Is there like a range for how long fillers usually last?
There is a bit of a range. It is gonna vary depending on the person. It's gonna be very depending on the area that we're using, and it's gonna vary depending on which fillers we are using. Many fillers, or on average, I'd say most fillers are indicated for about a year. So we do see a year, but again, some people will see a little bit less. Certain fillers like the Voluma is indicated for up to 2 years. Velour lasts about a year and a half on average. So somewhere between 1 to 2 years tends to be a good time frame for most people. Again, depending on which filler, depending on which area. We do notice sometimes that certain areas that are more mobile, like where there's a lot more movement, sometimes the filler seems to get broken down a little bit quicker than some of the more stable areas like the chin or the cheeks, which don't move as much, for example. But that being said, depending on which filler we use, which area we're doing, and how much filler you're getting, all that stuff also plays a role. Let's go with some of the other questions. So we do have that for the next question, because I know the next question was asking about how many fillers would I need. Obviously, I can't answer that question without seeing the person, and even if I did, each person is going to be a little bit different. But it is a good, it does bring up a good point, which is about how much volume should you expect with each filler syringe, because filler does come in syringes. Now, the Juvederm, the Restylane fillers, the Bolatero, they all come in as 1 ml syringe, and this is a teaspoon. And it's showing you that there's 5 mLs in a teaspoon. So I think the first picture is showing you just how much volume is in a half ml. So some fillers come as a half a syringe. Second picture is going to be 1 ml, which is equivalent to approximately 1 syringe of fillers. And then a 2 ml or 2 syringes of fillers is still, a little bit less than half of a teaspoon. So it's really not a lot of volume. Now, we try to put these fillers strategically in places where you're going to get the most out of that 1 ml. To see a little bit more volume, but as that picture is trying to illustrate, if someone's trying to really kind of change their face, like they really want to lift their cheeks, they want to cover their under eyes, they want to try to fix these these smile lines, and they want to fix their chin and add a little bit on the lips, you know, something like that. 1 or 2 fillers is definitely not gonna do too much of a difference. If you maybe just want a little bit more volume in the lips or a little bit more volume under the eyes, these smaller areas, 1 filler might be all you need. That might be plenty. But again, if you're trying, especially when you're talking about areas like the cheek, which is a much larger area and a little bit deeper, because we have to put the filler almost on bone usually, or you're talking about the jawline, especially the jawline. Again, 1 or 2 fillers, 1 or 2 ml is really not gonna do huge difference in most people. You can do, you know, maybe 2 ml. Sometimes you do in one treatment, but just realize that you might need multiple treatments that way, and that's absolutely okay. You don't have to come in and do 7 or 8 syringes at one time. Especially if you're looking for kind of more subtle differences. So we're not trying to always push, you know, people to do so many syringes. A lot of times we do like 1 syringe or 2 syringes. But as long as you understand that it's not gonna be, you know, as long as you have realistic expectations to what 1 syringe can do. And a lot of people are scared. They're like, well, I you know, because we do recommend like 3 or 4 syringes, and they're like, well, if I do 3 syringes, you know, is it gonna completely change my face? And again, this is trying to illustrate that even if you do 5 syringes, that's still only 1 teaspoon, which is really not too much volume. So it's not gonna completely change your face, you know, especially if you don't done correctly. Especially if you're doing some of these areas that require more like jawline or cheeks. Honestly, like 1 filler, half, like in the jawline, if people want to do like half syringe on each side, or 1 filler total in the jawline, you can redo that, but you're honestly probably not gonna see too much of a difference with only 1 syringe.
Do you use filler for marionette lines? I think you already covered that, but we had somebody ask. They jumped in a little bit later, so.
Yeah, no, we definitely do use filler for marionette lines. You know, you have to, again, look at the person. Sometimes doing some fillers in the jawline softens that area, because sometimes if someone has heavy jowls, you know, they see the marionette lines, and there's a couple ways to approach it. Sometimes the right way to approach it is to go in directly and fill the area. Sometimes the right way to approach it is to fill in the cheeks and the jawline to pull back a little bit, which softens that area. We're all set? Okay, I think.
Yeah, so I think if you guys have any other questions too, just, you know, let us know. Next time we're still going to try and be live at 5-ish, so sorry. But I just wanted to sort of say that we are doing a Mother's Day promotion right now, and it's, if you buy a filler, you actually get 20 units of Botox free. So and then we actually are applying a $100 gift card towards like a service at your next visit. So if you guys are interested, that promotion is happening with us, and I think it's going to be till May 14th. But yeah, call us up, and yeah, I think that's it.
Yeah. Happy Mother's Day, I guess. Well, it's too soon for that, but we have a Mother's Day promotion. Alright, yeah, thanks for joining us, guys. Again, send us any questions throughout the week, and then join us live next time, and you can ask your questions then. Hopefully everybody has a great weekend, and we'll see you next time.